Welcome to the On Your Mind podcast, where we are changing the mental health narrative, bringing hope and solutions. Here's your host, Timothy J. Hayes, psychologist.
Mallory Willis is a doctorate of physical therapy and specializes in pelvic health. She lives in Colorado Springs and owns a practice there. She is passionate about helping the community understand what pelvic health is and its important role in our overall physical health and mental and emotional health. Well, Mallory, welcome. It's lovely to see you. Thanks for joining us this morning.
Thank you so much for having me. I love your podcast. It's an honor to be on it with you.
Well, thank you for that. I was hoping you could start us off by letting us know a little bit about how you got into the work you're doing and what drives your passion for it.
Yes. So since the time I was in high school, I knew I wanted to be a physical therapist, and I was not exposed to pelvic health until I was in my graduate program at the University of Pittsburgh. And it was there that they introduced us to pelvic floor physical therapy or pelvic health. And if we showed interest in it, they trained us with their residency program. It just clicked. It was like, this is what people need. This is such an underserved population. A lot of people kind of shy away from it because it is the intimate areas of the body. It includes learning internal treatment of the vaginal and rectal muscles, but it's such an important part of the body. And I felt like my personality just matched with what was needed to help people in this area. And so I received 6 months of mentorship and training, and then graduated from that program knowing that that's what I wanted to specialize in. I moved back to Colorado Springs, where I grew up, and worked for a few years for a private practice, and just felt like there was a huge void in the city of care and people who specialize in this area. So I started my own business last year to try to help facilitate some different programs and provide better access for people to know that there's help out there for these types of issues.
My understanding is very few people understand the mechanics of that part of the body and the relevance to our stress levels, our mood, our mental health, etc. So can you give us a little primer course?
Yes, especially related to the topics of your podcast. If you Google a picture of the pelvic floor, you'll see that it's a bowl of muscles in the base of your pelvis. And these muscles have 4 jobs. They control our urinary, bowel function, sexual function, and then they are supportive of our organs. So they're part of our core muscles. So when we have issues in these areas, it could be leakage, it could be urinary retention, it could be constipation. But a lot of times we see pelvic pain, and that can refer, it could be in the region, but it could refer to their abdomen, their hips, their back. And these muscles are very tied to our nervous system. When we undergo stress or we are in kind of a fight or flight response, they reflexively tighten. That's just sort of how we're built. So it's a more common area that we see. If someone has dysfunction in this area, their symptoms are usually much worse with stress. And then if you add the layer of trauma onto that, it just gets very deeply intertwined with the body. And we have to acknowledge treatment of these muscles from all those aspects, like their mental health, their emotional health, what they've been through, and how their body's moving from a musculoskeletal standpoint.
Well, and I know that there's ancient wisdom about how when we go through something really deep emotionally, it moves in our bowels. They used to talk about moving in the bowels, and they're talking about that tightness, that tension, that carrying of stress that some of us do. Some of us carry it more up on the trapezoid muscles and in the chest, but some of us carry it more in our lower abdomen and, of course, in this pelvic floor area. And when you're going into the fight or flight response, you're getting ready you're tightening up, you're tensing all kinds of muscles. And we know about most of the others, right? From the torso up. But people don't pay attention to this specific area in the pelvic floor. So how do you help first diagnose or identify if there's a specific problem in that area? And then
Yeah.
how do you help people with therapy around it?
That's a very good point. The muscles are inside our pelvis. We really grow up with no concept of where they are, that there's even muscles there, that they can affect, how we move, breathe, pee, poop, stuff like that. So usually patients find pelvic floor therapists either by a referral from their medical doctor, which could be sometimes primary care, but it's usually a gynecologist, a urologist, or a GI doc. But there is a wave of people that there's such a gap in knowledge because this is it's not a new field, but it's very under-researched. So people are not as aware of it in the medical system. Patients start, Googling, they find weird stretches on like TikTok, and then they seek out their own pelvic floor physical therapist. And they come in and they're like, I think something might be due to these muscles because I've hit dead ends in every other aspect of my care. So however they get to me or one of us, we go through their medical history, what they've been through, like a typical medical exam. But to assess these muscles, we look at how they work with the body. So if you imagine your abdomen like an enclosed canister, we look at the rib cage and the breathing. We look at the abdominal muscles, and then we can do an internal muscle assessment, either vaginally or rectally, of the pelvic floor. And when we do the internal assessment, it's very gentle. It's with one gloved finger. We're testing for tightness and tenderness. And we're seeing if the patient, like what the patient feels at each muscle we palpate. We might like touch a muscle that makes them feel like they have to pee. And it's like, that's causing their urgency, not their bladder. It could refer to their hip pain. So after that whole assessment, we kind of put it all together. And sometimes people's like abdominal muscles are tighter than their pelvic floor, and that's more of the issue. But when we see like the chronic stress and pain with this area, it's usually we need to address all aspects or they're not going to see continuous improvement. It usually involves, breathing treatment and exercises, abdominal massage and mobilization, and then internal muscle or myofascial release. I kind of like to word it to people of, I know this is like scary and out there, but it's just muscles that are inside your pelvis. If you strained your neck, you would go probably get like either a massage, see a physical therapist or a chiropractor. We have that concept that we would get it worked on. And it's just the same idea. It's just muscles that are intertwined with nerves and connective tissue that are connected to all of our organs and our hips. So when it goes haywire, it can really wreak havoc on our body because it's so essential to our function. When also patients have trauma.
I was just going to say that was the biggest thing that I was, when I've had people who have this, they find the trauma at the source, or they're doing some kind of a stretch or release, and all of a sudden they're flooded with a memory of a trauma. So that was going to be my next question for you is how well prepared are you? How well versed are you in identifying and helping people work through if trauma is rooted in the dysfunction in the pelvic floor?
Yeah, that's a very good question. So early on, we did not get any training in this. When you start going into this specialty, I realized very quickly when I was working on my own that if I did not acknowledge this, my patients are not going to get better and they're not going to feel safe. So I started to just listen to them. That's the best advice I think any medical practitioner needs to, like, your patient will tell you what they need and what's going on if you ask the right questions. If I can get that so there can be a series of when that comes up. Sometimes they always fill out an intake form before I see them in person. And sometimes they'll put on there's a space they can put if they've had trauma. So then it's more open of we talk about it before I even touch them. And I let them know that it can just be related. And if they get a memory or we are working on an area that they are not comfortable with yet, to tell me. And we're not like no pressure. The patient is guiding the treatment. Sometimes though, they come in for a totally different reason, like maybe a female with urinary leakage, and she is unaware that she had trauma, maybe with some childbirth or sexual abuse when she was a kid. and it's just never like meshed in her head. And so as we start working, you can see like the confusion and, watch their eyes. And it's like, oh my goodness, like some things are coming up. So then we talk about it. And I try to just lay it simply of like, hey, this area of our body is really connected to our emotions and what we've been through. If it seems like something very, very like intertwined that they need more therapy, then I absolutely refer them to a mental health therapist or even like EMDR and stuff to work. And sometimes people are in that while they're actively going through.
And EMDR, for our listeners, is a very popular, well-researched, effective technique for helping people resolve the effects of past traumas. It's just it's a non-invasive, it stands for eye movement desensitization and reprocessing, and it's been around for decades.
Yes, very effective with having a history of trauma and pain in this area. Yeah, like I kind of acknowledge like where my lane is. My job is to help your body work and your muscles and joints. But I have to acknowledge that this is involved. And if you want to talk about that with me, I am completely open. But if you feel like you need someone to take you further, then here's like a good list of people that I trust that I work with. So that's kind of how I approach it with my patients. But it gets deep and it gets emotional. And as a practitioner, if you're not aware of that or careful, it can get heavy very quickly, seeing patients in a row that have had trauma, especially in this city. We're surrounded by like 4 military bases, and many active duty independents have experienced some type of trauma. And it's just something when I learned to go into it more of assuming that there's something that's happened in their life that's influencing this area, it becomes a lot easier to start to see big picture what this patient is experiencing and what they need. And the internal and manual treatment is a huge piece of it. But if we don't like leave space to talk about the emotions and the experiences they've been through, then they're not going to fully recover, and their body's not going to like release that stress response that it's holding. So
I remember the kind of a breakthrough that happened when people in my field and in psychology, social work, therapy began to open awareness of the effects of trauma. And it's not that many years ago that people started questioning, well, has there been trauma in your life, and how would you define that? And to help people understand that a seemingly innocuous event to one person might be downloaded as a very traumatic event by another. And so it's listening and learning to ask really good questions is a critical part of not just the assessment, but also the treatment.
Yes, exactly. No, I was listening to one of your podcasts, and I've heard other people say this too, but exactly, like it doesn't have to just be you were in a war, you were sexually abused, you had a traumatic birth. Like those are the big ones we like see, but it could be, it could be a traumatic experience with like a women's wellness exam, like a pap smear. It could be tampons. It could be falling on your tailbone and it ruining like your sports career. Like anything in this area can manifest. It could even be not related to this area. Like I've had patients who have had maybe a back injury or something, and then maybe a family member, like deep grief, like a family member passes away, and then boom, their body, like their gut and their pelvic floor just like shut down. And it's tricky. We got to like really go through the process to unwind it.
One of the things that we used to talk about with people is that as this mind-body energy system, we all have areas that we're just naturally strong in and somewhat weaker in. And so one of the ways we used to talk to this about people is if you put some people in a stressful situation, they might develop an ulcer. You put another person in that same stressful situation, they might develop migraines. You put another person in a stressful situation, they might develop irritable bowel syndrome, et cetera. So if you think in terms of, even if this situation would not be labeled traumatic by 1,000 other people, if it strikes me at a critical time in my life, let's say I'm right here, just after puberty has begun, and I'm still searching for my role in the world, and I have a crush on somebody, and they say, ew, when they see me, right? My response to that recoil and that fight or flight, if I've got a difficulty with my abdomen, if there's a weak spot there, or some hernia that I had from a sports thing that's right on the cusp of being a hernia, that spasm of muscle and contraction can cause a disruption there, or that tension can get locked in there, whether it's the pelvic floor or my shoulder or my abdomen. And awareness of that is so important I believe, for the therapist, whether it's a physical therapist or a psychological or sociological therapist, to help people, to educate them about, we aren't looking for, did you see somebody get shot in front of you? We're looking for what you downloaded through your life experiences that might be stuck in there with a negative meaning about you. And then every time it gets resonated into activity, that part of your body tenses or loosens, and, in what is potentially unproductive as part of a functioning pattern. So you might have, like you're talking about, urinary leakage, or you might have, encopresis, or you might have the constipation, and no matter what the other professionals would tell you to do related to diet or medication, it doesn't seem to resolve. Well, then let's turn and start exploring this mental, emotional, this energetic connection, if you will.
Yes, exactly. That's such a good explanation. It can be held anywhere in our body. And it's not that response is wrong. That's what I love incorporating, like nervous system down training is kind of what I call it, like decreasing the fight or flight response. We need that to activate. It's not wrong that your muscles tightened, but then they need to relax. And then, like, it's like keeping your hand on a hot stove. It feels hot, but if you keep it there, you're going to get burned. But we don't recognize our movement patterns and our tension holding patterns as dangerous. And sometimes it takes months to years for then symptoms to manifest. And then people are like, well, what the heck's wrong with me? Why can't I, like, go to the bathroom? And then we uncover all these layers of things.
And we uncover, if we're doing that good, private investigator questioning and listening, we start to uncover meanings the person has downloaded with this tension or with this dysfunction in the physical system that even the individual wasn't aware of, right? Because it happens in a heartbeat. It happens so quickly. It gets lodged in what we would call the subconscious or unconscious. So I'm not walking around thinking of it. And yet when it gets activated and it tightens these muscles or it loosens these other muscles, it has that impact on me.
Mm-hmm. Yes, exactly. I try to word it to patients as, I can't change, especially if they're still in active stress in their life. I can't change your stress, but I can help you change how your body responds to it. And I think that gives them and then they're a partner in the process. It's not like, I'm not here to fix you. I'm here to help you through this journey and help you get to know your body, again.
Yeah. And as you said, many of these patterns aren't bad, right? They're an automatic response to try and protect or help us stay functional a certain way. It's just that if they get hooked up with a negative belief about myself or a lack of feeling of safety whenever it gets resonated, then I'm stuck in a loop that is unproductive. Something that my body originally did to try and be productive and keep me safe has now become unproductive as a pattern. And It's uncovering that and helping the person relax through it and attribute a different set of coping mechanisms to that issue and a whole different meaning to it that can be life-changing for people.
Mm-hmm. Yes, exactly.
So what's the typical course of treatment when you have someone referred to you and they clearly have issues in their pelvic wall? How long does it take? What kind of follow-up do you need? What kind of exercises ongoing do you give people?
It definitely depends a little on the person. But I would say most typical, about 2 to 4 months of therapy. If it's due to a chronic pain condition or something like endometriosis or chronic prostatitis or interstitial cystitis, like a disease process we can't change, but we can help their body calm down around it. That's kind of a different category. But a typical pelvic floor patient, I would say, yeah, like 2 to 4 months, maybe a visit, an appointment every 2 months. And at least the model I see people, I see them for an hour and we go through, it's usually a combination of manual work. So I work on their rib cage, their abdomen, internal muscle release, and then retraining. So it's like we help their body like release the tension they're holding in the muscles. And that's with the internal treatment. And then we want to retrain it the right way. How are they supposed to move? What are your hips doing? Is your pelvic floor compensating for hip weakness, stuff like that. So then it's usually the end of the session is usually some type of exercises. If someone's in a lot of pain and has a lot of tightness, that's going to look more like kind of some yoga-based movements with specific breathing. And if we've got that pain cycle worked out of them and they're starting to hold the mobility that we've gained, then we're going to look more towards strengthening and building resilience in the body. So it becomes very functional. There's definitely a part of just like relaxation, like they need to just chill. They get to be worked on. Sometimes I still have to work, like if their pelvic floor is too tight and they're not responding to treatment or they're getting sore from it, like a little achy and stuff, then I'll go to their neck. And that's we could get on a rabbit trail of the neck related to the pelvic floor, but that really helps calm their body down. So then it like accepts the mobility better. Also through my system, like they have a specific program, whether it's breathing, stretching, or strengthening exercises that they're doing a few times a week at home to help keep their mobility. But I also try to give them really functional. It's not just like, go do these exercises for 30 minutes. It's like when you are driving and your kids are screaming, you can do like this in the car and like just like easy little things that are check-ins to start to change the body's response. And then once we can make it functional, they get better so quickly. So that's the fun part of individualizing it to every patient.
Okay, so help me understand what you mean when you say once we can make it functional, they get better so quickly. What is your definition of functional?
Functional, I would say, is just what directly applies to their life. For one person, might be on mile 4 of their runs, they're getting horrible pelvic pain. So it's like, okay, how do we help the run? Like that is what they need functionally. For someone else, it could be pain when they stand up out of a chair or leakage when they stand up and get out of a chair. Or
you're saying if they're driving in the car with the kids and the kids start acting up and they start feeling something uncomfortable, then you give them a way to remain more fluid or functional in their daily life when the symptoms would appear. Is that what you mean by functional?
Yes, exactly. Like practical for their life, not just like, well, you have to wait till you can be alone and then lay on the floor and then you know what I mean? Like,
right.
So, and then it's more meaningful to them. They get better quicker because they're doing things they enjoy. And they're like, it's like, what do you want to get back to in your life? And, with these bowel and bladder conditions, a lot of that is the ability to travel and do things because they're kind of bound to the bathroom by, like, I might, if they have IBS, I might have to go to the bathroom 7 times in the morning. So that can be a big deal of calming things down so they can go do things with other people. And that brings, so much back socially and stuff.
And so when you talk about getting things to be functional, I'm thinking about active in the moment, as I'm living my life, interventions that I can apply without having to call you for a session or, as you said, get to a private space and lay on my floor, et cetera.
Yes. Yeah. The basis of retraining the pelvic floor is really through breathing. And it's through 2 mechanisms. The diaphragm, when it moves, our breathing muscle, it literally talks to the pelvic floor, like just through pressure. When it moves up and down, it signals the pelvic floor to move naturally. Your pelvic floor is supposed to move like a inner little trampoline and be springy and reactive, not clenched tight. Like the concept of just being tight and like doing Kegels is not functional. So when we retrain breathing, and then they can do that anywhere, it actually signals the pelvic floor. And then, as we know, the vagus nerve runs through down the spine. And if you can control your exhales with your breathing, that helps put us into more of that parasympathetic, resting, calm nervous system tone. So I kind of call it like we're using your breathing to hack into your pelvic floor.
You just take a breath and get centered and think about this. What's an area that we've already covered that you want to highlight, or something about your work that we haven't even touched on yet that you want to provide information to us on?
I think the biggest message I want to help people know is that there is just knowing that there's help in this area, and that it's muscles that are part of your body, and we should have just as much knowledge and autonomy about these muscles as we do with our back strength and our squats and stuff like that. And it's so related to quality of life. Like the amount of people that suffer for decades without knowing that they could get treated relatively simply, it breaks my heart. It's like they don't have to suffer. That would be probably there's not as many pelvic floor therapists as there are just general physical therapists. So it's slightly hard to find them sometimes, but just the message of people, no matter what you've been through, if you're dealing with gut issues, urinary, bowel issues, sexual dysfunction, or any type of pelvic pain, like it's fine to get this area looked at, and it will help your quality of life.
Yeah, I would think that one of the biggest, there are these two big pieces that come to my mind. One is just awareness, right? Education about this area and how it is closely tied to our sense of self and our ability to function. Most of us are so fortunate in this area, we don't have to worry about where we're going throughout the day so I can be like 2 minutes from a bathroom. Mm-hmm. And yet some of us have that issue. And the second area is the shame. And so if we can destigmatize this, if we can let people know that for the most part, there are all kinds of things that can happen related to our stress management and our resolution of trauma and our physical health and strengthening certain muscle patterns. And that if we can help that become common knowledge, then people, even if they don't have it, can start spreading the word about it, right? Even though I don't have that issue, I, as a therapist, can start tuning in when I hear somebody talk about something and say, well, hey, I'm not an expert in it, but try exploring this, rather than, just saying, well, I think it's your anxiety and we need to help you with your anxiety. Because that's all I know, right? If I, as a therapist, haven't been exposed to this kind of work, the mind-body energy connection, the physical therapy, the things that happen on the massage table where people tap into traumas, if I was never aware of that, and I just think, well, I'm a therapist, I talk to people about what's happening in their mind, then I have very limited utility, especially for this kind of an area.
Yes, exactly. It goes, so we need to acknowledge it goes both ways. Like our anxiety and our stress can create physical issues, but we can have physical issues that amplify stress and anxiety. And then you're in a really tough loop. And we need people in both ends of this to be able to, meet the patient where they're at and like give them the resources they need, because it can be so many times they think it's just in their head. Like a lot of traditional medicine doctors, like, don't really understand. Their training is in other stuff. They do not have musculoskeletal deep expertise in how the connective tissue and our blood flow and our lymphatics like influence this area. And it's fine. Like that's physical therapy's realm. Like that's our highway, they have a different lane. But when patients start to feel like they're crazy and they've had every test in the book and everything's come back negative and nothing is explaining their pain, their stress and their mental health really becomes so compromised and so fragile. And if they knew sooner of like, hey, like, yes, exactly, it's not shameful. Let's just get these muscles checked. and see if it's related. And then boom, like people feel validated. They don't feel crazy. Their anxiety goes down. So super important.
You were mentioning in our pre-interview talk about building your business and trying to get the word out about this. I'm hoping that an interview like this will get in front of more therapists. And I'm also hoping you'll, in your marketing plan, in your educational plan, outreach plan, that you're going to be working to educate therapists as much as the physical doctors, because it is so important. And so many people as therapists hear from people who are stuck in whether I have stomach issues, right? Or I have anxiety issues, and they're not letting you know that they affect their stomach and their bowel and their bladder. But the therapists hear about this sometimes far more often than the medical doctors. And to have them have the awareness of this kind of work would be really valuable.
Yes, absolutely. Yeah, that's a very good reminder. I think things like that cross my mind, but then I forget how many more patients they see. It's like that point of contact can help so many more people than me trying to just talk to patients about it.
If you can do an in-service for a therapy group, that would be phenomenal.
Yeah, that's a great idea. And just I love just the interprofessional circle. There's so many pillars of health we need to address, and we can't do it all by ourselves. So,
well, and it's great to have specialists who have this ultra refined knowledge about a particular thing. And yet, if you don't have the integration of that knowledge with other systems, you can go down a rabbit hole and miss the whole point of what might be connecting these different systems.
Yes, exactly.
Well, I thank you so much for taking the time to share with us and our audience. If people want to find out more, what is the best way for them to learn about you and the work you're doing?
Yes, my business is called Peak Pelvic Health. My website is peakpelvichealthco.com. And we're on Instagram and Facebook. Yeah, we have a blog that talks about different topics that we're building out just for better patient education and just seeing how we can help the community. So,
well, this is wonderful. It's a delight to learn about you. I have to send a thank you note to what's her name? Hallie Brooke.
Hallie, yes.
Who got us hooked up together. So thank you so much for sharing time with us. And I look forward to a follow-up call in the not too distant future.
Yes, that sounds great. Thank you so much. It was an honor to be here.
Thank you. Take care. Mallory Willis is a doctorate of physical therapy and specializes in pelvic health. She lives in Colorado Springs and owns a practice there. She is passionate about helping the community understand what pelvic health is and its important role in our overall physical health and mental and emotional health.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.